Ensure you read all procedural notes before commencing the procedure.
The procedural notes give you all kinds of tips that you might encounter as you're doing this procedure. So they are very important tips.
The photobiostimulation light, a timer, the vacuum pump, and the Adipose stem cell procedure kit. The mediated kit comes in this box, and all the materials and consumables are contained within this kit. These are the standard veterinary items that the vet will require when doing this procedure. Prior to use of the kit, the bench area where the process is to take place should be sprayed with 70% methanol and wiped down. Stage 1. Preparation of platelet-rich plasma, or PRP.
This is real easy. I have my technicians, when they're putting in the catheter, just draw the blood. We need about 15 mLs. It's not a big deal. Put it into these yellow top tubes, fill them up. They're vacuum tubes, so they'll just draw it up to the level they need to be, which is up near the top of that white label, and invert them just like you would any other tube so that it mixes up. Then we put them through 2 simple centrifugations, as you'll see.
This equates to approximately 5 mils of blood per tube. The tubes are then centrifuged for 1000 Gs, or 2,500 RPM, for 4 minutes. The plasma layer, or the top layer, is then removed from each tube with a small transfer pipette and placed into a 15 ml tube.
You just want to make sure you get as much as you can without getting the buffy coat on top of the red blood cells there. So you get as close as you can without pulling up that buffy coat. And when a good tip is when you're using that suction, squeeze it all of the way before you put it in, and don't just let go of it because it will pull up that buffy coat. Gently let go of it and pull up the portion that you want. The centrifuge has really nice inserts that fit every tube size that we're going to use. They thought of everything.
At the end of the centrifuge, there should be a pellet of platelets at the bottom of the tube. Remove and discard the top platelet core plasma down to 3 mils in the tube using a small transfer pipette.
We all know how to read a meniscus, and so do our technicians. Just straight down to exactly 3 mLs left in that tube. See the pellet at the bottom of the tube?
This is the PRP.
And then you mix it up. Mix it up so you get it back into suspension.
Is now activated by removing 0.5 mils of solution G using a 1 ml syringe and adding it to the PRP.
I suggest anytime you pick up one of these bottles that you mix it up. Remember that if there's enzymes in there, you don't want them settling out. You want to mix everything up before you pull it out.
Mix the solution well. As you can see, the PRP has now formed a solid gel. Once the gel has formed, leave it at room temperature and the PRP gel will partially dissolve over the next 1 to 2 hours.
And that's why we do it first, because it takes 1 to 2 hours. But in the procedural notes, you see that if the room temperature is cold, that gel may not be releasing those growth factors from the platelets in about 2 hours. So you can put them into the water bath. You're not going to hurt them at all. It just speeds up the reaction, and you'll get that a lot quicker. So if you're not seeing the growth factor separate out from that gel, just put it in the water bath and let it sit in there. In about 15 minutes, you're going to see that you're going to have some nice growth factor.
Add 0.5 mils of gentamicin, concentration 40 milligrams per mil, using a 1...
Please, when you're using the Gentamicin, use 20 milligrams. 20 milligrams. It will not be 0.5 mLs of the bottles that we use here in the United States. It'll be 0.2 mLs. So we want 20 milligrams. Look at the procedural chart, the flow chart. All of that is depicted very, very well.
You have now reached the end of stage 2, preparation of solutions.